Hi guys, welcome to the series where we choose our dream branch, our dream college, and we make that decision wisely and with a lot of groundwork. So this is probably going to be one of the last videos in this particular section because I'll end up doing everything I wanted to do with steps to choose your final branch. So please press the bell icon before you go further. Next, I want you to see what kind of exposure that particular college offers. If you're doing a general surgery residency in a particular college, do they have exposure of plastic surgery? Do they have exposure of, neurosurgery or maybe CVTS surgery? Those kind of super specialization exposures are really important if you want to do a MCH. For example, if you want to do a ophthal, degree, I want you to see if that particular college or institute offers you experience or rotations into cornea, into neuro-ophthal, into glaucoma, into retina, into vitreoretinal services. So that kind of exposure, super specialty exposure is really important to seek guidance in that particular branch. And what you need to do after you finish this residency. So you need to plan a lot ahead. And today there is no end branch. End branch ka game is gone. Even if you're doing ortho or ophthal, I must tell you, once you enter residency, you will know it for sure that you will need to do something else also. You can call it a fellowship, but you need to do that if you want to stay relevant in the 3-tier city or the 2-tier city setup, right? You will need to do certain amount of fellowships. Seek advice from your seniors, from your mentors, people who have taken that branch, people who are in that branch for certain amount of years. Take their opinion, take their professional, help. Do some amount of shadow practice. If you want to take up psychiatry, like I wanted to at a, amount of time before, I finally took up ophthal. So I used to shadow a psychiatrist. I used to sit in the OPD for the 3 hours he took the OPD. And I did it for 15-20 days before, making my mind about it. So I did that for 15-20 days, 3 hours daily. Lot of entertainment. It was a lot of entertainment, lot of, learning as well. So I want you to choose 2-3 branches and do a shadow practice with physicians. Nobody will say no to you. Nobody. In your colleges, you can go back, talk to professors, talk to seniors in that particular, And finally, I want you to consider your family as well, because you're at a stage where your parents need and expect a certain amount of help from you as well. You're in your 30s, probably very early 30s or very late 20s, and we need to see where, if we will be close to our parents, if we'll be able to reach to them, or they will be able to come to us if they feel like if they feel low or you feel low. So we need to take care of that aspect also. We need to see what our family is planning ahead. Is there some amount of flexibility in the program you're gonna join? So think about the residency program as a whole and think about all the factors. Finally, listen to your gut. Do a personal consideration 3x3 analysis. What 3 things are important for you? I'll teach the 3x3 analysis in a separate video. But I want you to come up with 3 final branches that are available at your rank and marks and the amount of money you are able to pay. Use your gut feeling, but then objectively, I did a 3x3 analysis and we will do a 3x3 analysis in the next video, and we'll finish up with our counseling series. That will give us the final verdict of which branch we want to choose and which college we want to choose. That's all from my side, guys, in this counseling series. Thank you very much for staying together till the end. All the very best, and I'll be coming up with more videos that are more and more helpful for you. Please do share the video and subscribe to the channel. Love you all.